There are docks in Salford. There are bleaching works, dye works and cotton mills. 172,000 people live in the city. 132,000 are men and women of working age. There are 22,000 people of pensionable age. And 40,000 children, children who can never know when spring comes. There are no trees and no flowers on Primrose Hill. I came back to see what changes there were in Hankey Park, where Love on the Dole was written 22 years ago, a district that gets its name from Hankinson Street. Very little seemed to have changed. I found the same grim backs and the same drab fronts. The same houses, but 20 years older and that much worse. Many of them were condemned years ago, but they're still lived in. The housewives still keep up the old tradition of brownstoning the front steps. And you can still buy a hot-cooked meal at the shop around the corner. There are still interiors like this. All the same, there is evidence of more money to spend and more things to spend it on. But you can't wash away grime with money. Grime that rises from 1,000 chimneys and falls on Salford, 1,000 tons of it every year. What happens to people's health in these surroundings? Before the health service, this was an area of the sixpenny doctor. You paid 6pence a week to go on a doctor's list. Now everyone is on a doctor's list. What has this change meant?
Right, there we are. There's your prescription. Now mind what you're doing, won't you?
Yes, thank you, Doctor. And I'll see you again.
I asked a doctor who is carrying on the practice his father had before him.
That chap's not too bad for 77. The reason being that he gets regular injections for pernicious anemia, which is quite a serious disease if it isn't properly treated. Before the health service, my father, who was here for 40 years before me, must have known many cases of this and other diseases which weren't adequately treated because the patients thought they ought to pay as a fee. We never insisted on this, and of course they could have gone to the hospital, I suppose. But nevertheless, many people didn't like the idea, and consequently they didn't attend regularly and went about in a chronic state of ill health. Now, I think this removal of any financial barrier between the patient and the doctor is undoubtedly the biggest single virtue of the National Health Service. There are snags, of course, to this service. Many people, many more people than before, now come to these surgeries, and we do frequently get very full surgeries with 25, 30 or more patients in. They seem to look upon the visit to the doctor as part of the shopping call in here between going to the butchers and the grocers. And what's more, they demand things from me rather than asking for an opinion, which is my job. They're in a very small minority, but nevertheless they cause a disproportionate amount of trouble. In spite of these difficulties, I think the general practitioner can now do very much more for his patient than he did before.
Many doctors are pleased that people can visit them more freely. They say they can discover disease at an early stage, but it often means a long wait just to get a prescription. And the prescription has to be made up. Every year, more than 200 million prescriptions are dispensed in Britain, and not all of them by doctors.
Recently, many of my customers have asked me to prescribe for them for their minor ailments. This I have done, and they are quite happy to have me both prescribe and dispense a bottle there and then, and they express the point of view that it's mainly because of the time of waiting in the surgery. Men in particular have made this point, and they are rather afraid of losing some of their wage by the time spent in surgeries.
Some people are too ill or too infirm to be able to attend the doctor. And for them there is another service, the district nurse, who looks after them in their own home. In weather like this, her hands are very full, particularly with cases of bronchitis among old people. Here in Salford, smoke and fog are a real danger to health. Recent medical research suggests that the smoky atmosphere of our cities may be one cause of lung cancer. Last year, 100 people died from lung cancer in Salford. Mr. Kennedy is being treated for bronchitis made acute by a recent heavy fog. This sort of atmosphere doesn't help the tubercular patient either, and the number of people who get TB is decreasing too slowly. With modern hospital treatment, they can be cured. But in the country as a whole, there is a shortage of beds for hospital treatment, partly because we have not enough hospitals, but also because many of those we have are inadequate. Is it possible to carry on modern treatment in a hospital like this, where to reach the operating theatre, a serious case may have to be wheeled across a bridge in hail or in snow? Cramped for space in the sterilizing room. Preparing meals in old-fashioned kitchens. All this is making the work of the hospital staff more difficult. No wonder that wards have to be closed because of a shortage of nurses. Let us hear the matron of a large hospital.
We have a large number of nurses in this hospital. I have 300, but I am about 60 short at the present moment. These are very grave shortages, and sometimes I just wonder how we're going to improve things or what we can do. Sometimes I think that the reason why we have our difficulties are because girls who leave school between the ages of 15 and 16 must do something towards filling in their time before they're able to commence their training at 18. And very often, in spite of the fact that they long to be nurses, they do other things and then perhaps lose interest or lose the urge to come into hospital. We have quite good cadet schemes coming into operation, and there's no doubt about it that these are helpful, but they're not enough. Conditions are vastly improved nowadays, but the nurses that we have here are far too overworked, and therefore they have very little time for their studies, become overtired, and also become disheartened.
The shortage of nurses is making it harder for those who have stuck to the job. But the shortage may not be due entirely to unattractive wages and hard-working conditions. Nursing has always been a vocation which calls for great personal devotion to the sick. Is there a danger that the sense of vocation may be watered down by a system under which the sick person could become a number on a register, one of the queue? Take outpatients, for example. How often have you had to wait for hours on a hard bench in a drafty corridor? In Salford, the outpatients departments have been organized to avoid this waiting time. Patients are called to see the specialist by appointment. Is this a good solution? I asked a doctor.
We have an appointment system in our hospitals, which means that a patient only has to wait quarter of an hour to 20 minutes, that's in theory anyway, before he sees the consultant. This seems all very well on paper, but it does mean that in many cases one fails to secure an appointment for a patient for anything up to 7 or 8 weeks. The old system, whereby a patient was sent to the hospital by his doctor and saw a consultant after waiting, say, anything up to 3 or 4 hours. It didn't matter a great deal when, after 3 or 4 hours, he secured an early diagnosis which relieved the anxiety he would have felt for all these weeks waiting and worrying about his health. The reasons for this state of affairs are several. Firstly, there's the increased demand of the public for hospital services. Then, in the old days, the consultants started early in the morning and worked until 3 or even 4 in the afternoon until they'd seen all the patients the general practitioners had sent them. Today, the consultants start at a fixed time. They have so many appointments allocated to them, and then they are finished. Of course, I do believe that none of this would have come about at all if it hadn't been for the clamour of the newspapers and the politicians. Most of us were perfectly satisfied with the old state of affairs. However, there's some hope for the future, because in Salford we have formed a committee which consists of representatives of the general practitioners, of the municipal health services who originated this idea, and of the hospital management committees. And we have done many things to improve matters for both the patient and for the general practitioner. For instance, there's the bed bureau.
Bed bureau here? Yes, doctor. And the patient's name? And his
Any
name,
doctor in Salford with a patient needing to go into hospital can telephone the bureau and most times find a bed.
Yes, sir.
The bureau covers all the hospitals in the city, and on its walls are charts indicating the state of every bed in every hospital.
Yes, there is a bed in Mr. Brown's ward at Hope Hospital. Temperature, 103.
Within 15 minutes on average, the doctor will get a call back to confirm that the hospital has accepted his patient. The hospital X-ray service is also available to the general practitioner. If he wishes, a telephone call will bring him a report within a few hours.
Of urgent importance. The lumbar spine is clearly shown, and there does not appear to be any evidence of a fracture.
If a patient needs a blood count, or if the doctor comes across an infection he cannot identify, the hospital laboratory service is there to help him. These services are at the elbow of every doctor in the city through the cooperation of the 3 branches of the National Health Service: family doctors, hospitals, and the Public Health Service. It's working well in Salford, but is there room throughout the country for more cooperation between these 3 branches? Many doctors say that this is the greatest weakness of the National Health Service. I raised this question with the Medical Officer of Health.
Cooperation is the keynote of the National Health Service today. There can't be enough of it. Indeed, I think instead of 3 branches of the National Health Service, there should be 1 branch only responsible for all services for the health of the people. My job as a medical officer of health is to promote the health of the people by better health education, better nutrition, better housing. And secondly, to prevent preventable disease by removal or lessening the environmental evils of bad housing and bad food. And also to prevent disease by developing the immunizations and vaccinations and protections against disease. Not so very long ago, there was much bad food, bad drainage systems, dangerous diseases like diphtheria and rickets. There's been grand progress lately, but new problems loom ahead. The problem, for example, of cleaning the air, the problem of building up the physical health and the mental health of the people. Yes, there's no more important job than that of preventive medicine, and it's got to have a great deal bigger place, not merely in our national and in our local budgets, but also in our minds and the way we look at things.
The local health services are in the main concerned with preventive medicine. They start before a child is born in the antenatal clinic, where medical examination and health teaching run side by side, helping to prepare the mother for when her baby comes. If she is healthy and if the birth is a normal one, she can be attended to at home. I suppose most of us drew our first breath in the capable hands of a midwife. If the birth is likely to be abnormal, it should take place in hospital. But otherwise, the general medical view is that this natural function is best carried out in the familiar surroundings of the home. After all, babies were born before hospitals existed. In their early years, many babies are brought to the child welfare clinic, where a regular watch is kept on their progress. But some people say that these clinics could easily lead the mothers to worry too much about their baby's health. They say a confident mother with plenty of milk for her baby is more important than a weighing machine. One job of the medical and nursing staff is to inspire this confidence. Through the school health service, the child's health is watched over by the local authority until it's time for him to start work as an insured person in his own right. The local authority's interest in the health of the family lasts for a lifetime. Health visitors coming to people in their own homes give advice and help on any problem of family health. In Salford, the health visitor service is a matter of local pride. I went with Nurse Brooks on her daily round.
Hello, Miss Haney. How are you?
Oh, fine, thanks.
How's the new house?
Oh, smashing.
Oh, I'm very glad. Mrs. Haney's been very unfortunate. Just like Mrs. Clark we're going to see now. Her husband died about 4 weeks before this last baby was born. She's got 8 other children, and she did lose 3 of her babies when they were infants. Altogether, they're a very nice family, but they have had a lot of accidents recently.
So?
In fact, this last baby was planned for a home delivery, but at the last minute, Mrs. Clark had to go to hospital for an emergency operation. The whole family had to be looked after by her eldest daughter, who's only 17. I'll just see if she's in.
Right.
There's one little boy of 2. He's had to go to the day nursery.
Hello, Miss Brooks. I'm just as I want you.
Hello, Mrs. Clark. I've got Mr. Reed with me. May we come and see
pleased
you?
to meet you.
How do you
Yes,
do,
come
Mrs.
in.
Clark?
Thank you.
Sit down, Mr. Reed. It's cold, isn't it?
It is, by Jove. Thanks very much.
Oh, it's a lovely baby.
And she look well.
She does look well, yes.
Yes.
And she's only 6 weeks old.
6 weeks old, 7 weeks old on Thursday.
7 weeks old, yes.
Yes.
She's fine.
Yes.
And how are the rest of the family?
They're all fine, but little John, I'm very worried about little John. He seems to be fretting.
Why, what's the trouble?
Well, we have to watch him. He hits the baby and does, and when he goes to bed at night, he won't stay in the bed. He comes down and he asks is his mama still at home. Wonder what it is.
Well, you know, so many bewildering things have happened to John in the last 2 months.
Yeah.
Losing his father, and then you went away to hospital. You know, he came down one morning and just found that you'd gone.
Yes.
And then you came home with a new baby. I think that he'll get over this, but the thing for you to do is try to reassure him all the time that you aren't going away again to leave him.
Yeah, I do, you know, I do tell him that his mama won't go away no more, you know.
If he hadn't settled down so well in the day nursery, I'd suggest that he came home again to you. Perhaps when you're feeling a little stronger, you have him home with you, and he'll see more of you.
All right, Miss Brooks.
Yes. Now, about the baby. What do you think about the immunisation?
Well, I want her immunised, but I was wondering when to bring her up.
In another health visitors district, I asked Mrs. Morris whether she liked the health visitors.
No, I don't, for one reason. They try to dominate married people who has a lot of children. They've no kids of their own. And they're sending bits of girls round who's not married. They know nothing, but they try to tell you what to give your children. And because I have 9 kiddies and I'm for my 10th, they try to tell me to go to birth controls and things like that, which I wouldn't do. Not for any of them. And when they come near this store, I always insult them because I don't like them.
But most housewives agreed with Mrs. Hall, and from her I received a very different opinion.
Oh, I think they're really marvellous. You see, my mother died when I was quite young, and my sister isn't married, so we didn't know what to do for the best. And after I'd been home a couple of days from hospital, the health visitor came, and my husband and I had a nice chat to her. She told us all the things that we could do at the clinic. They weigh the babies for you, they give you all the advice on the feeding, and
And did you take the baby round?
Yes, I decided to have a try, and believe me, they've been marvellous in every way. They've helped us, and oh, it's really marvellous.
Every mother is on some doctor's list. What does the doctor think of the local health services? I asked a general practitioner.
These services absorb a great many trained nurses, and these trained nurses are very seldom looking after ill people. Because of the very nature of these services, it is only well people who attend most of these clinics. Now, we know very well that all our large hospitals are understaffed, seriously understaffed. Many hospitals have to close wards because of shortage of trained nurses. It's in these hospitals that the trained nurses are required, and one can't help but ask the question, is the Minister of Health correct in not making better use of the limited trained nurses of the country?
Perhaps 4.5 years training in a hospital is too long, but as to the health visitor's valuable contribution to hospitals, there can be no doubt. I spoke with a specialist who was just finishing his round of the ward.
Thank you, Mrs. Thomas. Perhaps you could arrange for a home visit to be done, could you?
Yes, tomorrow. All right.
That'll be fine. Yes, thank you. Mrs. Thomas is a health visitor and brings to me and to the hospital reports collected by her colleagues about the children's home background. A hospital doctor has a great difficulty in appreciating the background of his patients because he is not able to see them except detached from their friends and relatives and from the problems that exist at home. But to have reports brought to us and also to have our instructions interpreted to the parents and to the household makes the understanding of a child's illness very much easier.
This liaison between hospital and home is surely something that our medical service should provide all over Britain. The care of old people's health is also the concern of the local authority.
Breathe in deeply and out.
Not only treatment in clinics, but treatment in their own homes. Miss Crew is 74, and like many old people, she can't look after her feet, so she is being attended by the chiropodist. Mrs. Finn is being attended to by someone from the Old People's Personal Hygiene Service, another service which is very necessary for old people who cannot look after themselves. But perhaps the most necessary thing of all is just that someone calls to see them. Like the home help who comes in every day to look after Mr. Wilkinson. For him, it's not the housework she does that counts, but the friendly human contact. For who can bear to feel himself forgotten? We can't all be useful to the end of our days, and when our work is done, it's hard to sit and wait, knowing that we are out of sight and out of mind. It's understandable that many old people bitterly resent the idea of going to an institution.
I like being by myself. This is my home. I've been here 45 years. Yes. I want nobody. Don't bother with anybody. People are false if you say anything to them. You can't trust them. Yes. I'm all right here on my own. Of course I am.
The problems of old age are many, and among them, perhaps aggravated by loneliness and boredom, is mental breakdown. Salford's medical officer of mental health had this to say.
Mental health is the greatest public health problem in this country today. Nearly half, 46% of all hospital beds are devoted to the care of the mentally ill and the mentally defective. This is an increasing problem. Each year, more and more people are admitted to mental hospitals. Now, there are a number of reasons for this, but two of the most important are, first of all, we are an aging population, and the incidence of mental illness in the very old is higher than any other section of the community. The second reason is readmissions are increasing every year. And I think the reason for this is that a patient is taken out of adverse social circumstances where he has broken down and admitted to mental hospital, where he has all modern care and attention. When he is discharged from hospital, he goes back again into the same social conditions as he left from. I think that the answer to this is a good home social work service, in which the social worker visits the home, sees the relatives and friends of the patients, and shows them how to look after the patient when he comes home again. Shows them how to help the patient to readjust to home conditions. In addition, the social worker can fit the patient into suitable employment, can see that the lonely patient is introduced to a social club.
Who are these people? They look normal enough, and so they are, people like you and I. 4 quite normal people can have a temporary breakdown. Here they are, dancing with people who are perfectly well.
A woman, aged 40, frightened to leave her home through abnormal fears, would not travel on public transport, unable to concentrate on household duties. Attended club for social contact and is improving slowly. A man, aged 35, referred by doctor for admission to hospital on mental grounds, had strong ideas of persecution with a feeling of guilt. Seen by psychiatrist and encouraged to attend social club, he joined in all activities and shows much improvement.
For those who require more frequent contact, there is a day clinic. Even the simplest activities carried on with those who are not sick can help a great deal. How does mental trouble arise? I asked the child psychiatrist attached to the Salford Health Department.
We are being faced with enormous problems of mental ill health, not only amongst adults, but also in our children. Signs of emotional disturbance can, and often do, show themselves within the first few months and years of life, and their early detection and treatment may do much to prevent the later development of more serious illness. It may surprise many people to know that children are being brought to clinics such as ours, which is run in conjunction with maternity and child welfare centres, at the tender age of 12 months or even less, with complaints that are primarily of psychological origin. These are usually expressed, of course, as disorders of feeding or sleeping. These neurotic illnesses in infants are often the result either of some upsetting and overwhelming event that has happened to the child, usually, sometimes anyway, avoidably, or to a disharmony in the relationship between mother and child.
A happy mother will have a happy child. She's also likely to have a healthy child. But can a mother give her children a healthy start in life in these surroundings? Has she been equipped with the knowledge of how best to feed and rear her children? Can a home like this provide the security, the love and the happiness which go to build a healthy person? No one would deny that bad housing, poverty and overcrowding are evils that contribute to ill health. Well, slowly we are clearing the slums, but moving into a new house will not necessarily bring with it the knowledge of how to live healthily. We still have a lot to learn, and in Salford, health education is being carried out in many ways. This Mothers Club is one result of the health visitors' work in the home.
To you that
children's feet, unlike adults' feet, have not got hard bone structures, but they're little bits of gristle, and the spaces between the joints, instead of as in adults, close together, are greatly spaced. That no matter how they're distorted by these tight, small, shrunken woolen booties or tight footwear, they don't feel pain. And that is a significant factor. You've no warning. If a child cried out in pain because these things were hurting, you would naturally do something about it.
Through the enterprise of a local newspaper, a children's health club has been started. The mayor came to enroll new members and to present them with club badges and rules of health. Perhaps it is only through the young that we can hope to create a healthy nation. This was a pleasant ending to my investigation in Salford.